Hello and welcome to Pisgah Health Today. My name is Angela Owen. It's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. We have 2 very special guests today. We have Lori Garcia McCammon. She is the Executive Director of True Ridge, and she is the positive force behind the organization, working hard to create better lives for those who share her heritage and culture. She is driving social progress, creating tangible change, and making strides in advocating for the people who face barriers every day. After years of witnessing injustices from inside the court system, Lori wanted to do the right thing for the Latinx community. Her passion is to advocate for the Hispanic population in Western North Carolina and to ensure that they have an effective collective network of services within reach. Welcome to our program today, Lori.
Thank you, Angela.
We also have joining her Marianne Festa. Did I pronounce that last name correctly there, Marianne? Marianne retired from another organization last January, and just 2 weeks later, she came on board part-time here with True Ridge. She's been a frontline case manager working with families to become self-sufficient. She's been doing that for many, many years. She shepherds people to a better place, and she's an encourager, very passionate about the work that she does. And she is committed to helping improve the lives of Western North Carolina residents through this work here at True Ridge. Welcome to our program, Marianne.
Thank you for having us.
We are thrilled, and I'm looking forward to learning. So Marianne, why don't you start by telling us, what is True Ridge?
Well, Lori Garcia McCammon, who's also on this interview, and her husband, Ed McCammon, saw the need in 2017 to serve Latinx families in predominantly Henderson County and surrounding areas. She had been involved with other organizations and saw a void because Latin Hispanic families do not have English as their first language. So language access was the biggest barrier. Also, so many were undocumented and fearful of seeking services for their American-born children. They lived very modest, meager lives, low-income housing, substandard housing, fearful of their landlords, fearful of losing their work. So many victims of crimes and domestic violence, sexual assault, needing someone to advocate for them in the court system. And Lori pretty much single-handedly back then shepherded them to through the process to the organization that I used to work for if they needed housing or childcare. And I guess I've known Lori 10 or 12 years. Then in 2018, when the ICE raids took place in Henderson County, so many of these already vulnerable families lost their breadwinner. They were either deported, detained, or incarcerated. So now we had women and children at a loss. And somebody before me, Lori, wrote a grant to the Western North Carolina Episcopal Diocese, and they funded a program called Serving Those Left Behind. And this past spring, they renewed it. So we are still serving families that struggle to maintain a roof and maintain safety for their children. It seems as though, my estimation is, anytime Lori and the board see a need that's evident for the Latina population, that we try very desperately to fill that void. And educating our other part-time staff on the resources in the community was probably the main reason why I came on, because I had been in the Henderson County area for 13 years and knew every possible resource. So that's where we're at. Then COVID hit and we got all locked down, and we started to write grants to help those families with rent and utilities and try and keep them safe as best as possible. And we've been doing that as a sideline, but that sideline has definitely occupied 70% of our week. And then we continue to go to court to advocate for the victims of domestic violence. And recently we got a grant to have a mobile office. So we are going to be able to be with our clients wherever they're at their job, at their
Places of work.
Places of work. Yeah, I was trying to think. The farms that they harvest at, their schools, wherever they are, because so many don't have license. So we can go to them.
Well, Marianne, I love the energy that you bring in as you're talking about it. And Lori, I love that you saw a need many years ago and you said, I'm going to do something about this. And you put your hands and feet to the task and put together this organization here at True Ridge. So Lori, how specifically has the grant from Pisgah Health Foundation, how is that helping you serve Western North Carolina residents?
Well, I mean, for us, it was actually the first time a funder was able to, or was willing to give us money for operations, which is something that we desperately needed. We had been getting grants for emergency support for the community, but we said, you know, we need to pay our staff. So how do we do this? So we actually asked for an additional $7,000 to be able to help with a month of operation costs, of program costs. And you all were the first agency that approved this, in addition to the funding to help the community. So in what way did you help? You helped with the amount of money that we got from you. We were able to help people from 7 different countries, from Mexico,
Wow.
Colombia, Guatemala, Honduras, El Salvador, Panama. And it was funding for people who were not able to get a stimulus check. So this is what we asked for. We, like Marianne said, we were able to help. And this one, we were able to help 44 clients with financial assistance, 20 clients with food cards, 96 adults, 71 children between the ages of 1 and 20. We have some statistics. I have 25 of these families have bank accounts out of the 44, out of actually the 64, 28 families, only 28 have internet, 13 have computers. So we found a need right there. And I said, we have to ask somewhere else for some money for that. Their average food cost was $157. The average gas cost weekly was $47. Average rent close to $600. And the average financial help that everybody got was, we were doing checks that were limited to an amount that we wanted the money to last. So as many people that we could help, that's what we were looking at. So it was mostly a $300. That's what we were able to do. And we did $550 for counseling, because we saw people, you know, COVID has really affected, there's been a lot of effects with the mental health. And so we had asked for some funds to help with that too. So we paid counselors to help some of the families, because some of these families, I believe there was like 7 or 8 of the families were victims of domestic violence as well. So you helped enormously.
Well, and those statistics are incredible. You know, I think it's so easy for us to forget about those who, a basic computer, right? Especially right now, it's hard for the children to even do school if they don't have some sort of a computer to access and that sort of thing. So, wow, that is just tremendous when you go through those statistics.
And that was information that from the funding that we did, like from May through August. When the kids started school, we started contacting some of the schools to find out, what are we going to do about computers for kids? What are we going to do about them connecting and getting back into school? So with a lot of the information we've gotten, a lot of the schools say, look, almost 100% of our kids have computers now, hotspots. So
yeah, the hotspots are the hard thing, because there are so many mountains around us. Even just for me driving to work, I go through several dead zones, and I'm not very technological, but the concept of hotspots, there could very well be a shortage of them. So
There was.
depending on how you sign on, you might not have your hotspot today.
Wow.
So, and it's usually the most disadvantaged that are continually disadvantaged. So
As I listen to both of you, I think there's so many layers behind this work. You know, Marianne, a few moments ago, you talked about knowing all of the different resource groups and how important that is. And I hear you talking about, Lori, reaching out to the schools, and there are just so many different layers to the services that you're providing there at True Ridge for these special people who are very important in our community. What else would either of you like our viewers to know about True Ridge, and how can they come alongside you? How can they get involved and show support? Lori, I'll start with you on that question.
Well, I wanted to also mention that we were able to do the census with our clients. So we were able to help with that. And we were really, really proud of being able to connect with our clients. And actually COVID made that easier for us because they were our client. We had permission to contact them. So that was really, really cool. We love that. And so Dogwood actually came behind us and supported us with that one.
Oh, that's nice to hear a silver lining behind COVID there. So there's a little silver lining.
That's what it's been a blessing and a curse for some people, but for us at True Ridge, which we are a small organization, we're going on to 4 years in January. For us, it opened doors. We also got we got a contract with the state of North Carolina for the Department of Health and Human Services to educate our Latinx community on COVID. And that was very successful. It was outreach to 8 counties, all our surrounding counties. We took information, we took PPE kits. And so people around the areas got to know who True Ridge was. So I believe that we've done the work that we were never able to do before because of a contract that was given by the state in order to get us out there, to get the word out. And we're right now, because of all these statistics that we've gotten, we also notice kids being disengaged in education right now. So we've actually, somebody heard me talking on a Zoom call, on all these community Zoom calls about the problem with disengaged Latinx students with education. And we're starting that program with a middle school starting in January because we had an incident in one of our schools I'm sure you've heard of in Henderson County. And so we're going to put this out till January. But we are working with 2 students here at our office that were having problems engaging with the virtual classes. So I don't know what else. Education is our key. You know, for us, education, if we have education and we can educate our community, inform them, because I don't like to say we're educating them because they don't have education. They do, but they may not know of the resources we have here. And that we're very passionate about sending people. We can't do it here. We're going to forward you to where you need to go. And Marianne is amazing about this. So
I love it. Marianne, what would you add, especially given all that you all are doing for the Latinx community? What would you add to what Lori just shared there?
I know we just got off the Zoom call and they talked about staff fatigue. I think our staff has been amazing, and we bolster each other. There's smiles every day, even behind the masks. We see them in everyone's eyes, and we all love the people we serve, and we love, I mean, I answer the phone and I say, dear God, please make this person speak English. And most of the time they don't, and I say, please hold on. But I want them to know that we are here to help, and I might not speak their language, but I will get somebody to speak to them, and we will give them the resource, or we will give them the rent, or we will give them the internet. And I just wish more people, I mean, we live in an amazing area. That all have been working tirelessly to make our community safe for COVID and get us through this, but I just wish more people woke up with the incentive to care about somebody else, to not be so self-centered. But we happen to work with very selfless people. I just wish more people would either give your time, give your talent, or give your treasure.
Well,
I
I
have
think
one
that's
more
a,
thing.
go right ahead, Lori, please.
Look at these little tiny things, which are the little face masks for kids. I am so proud. I said, I just saw it right here in my drawer when I opened it. I said, not only have we been able to give out for adults, but we've had over 700 masks for kids made that we are sending to the schools because they didn't have that size. So anybody from the schools that needs anything, they're able to call here. Social workers that visit families, they have the ones kid sizes, so the kids don't have to have the floppy thing tied up in the back or anything like that. So we're proud of that too. We've just had so many people we're doing gowns from one of the churches, gowns for finding people in the community that sew, our community, to make gowns for doctors' offices and getting paid for it. But these are because of the help that we're getting from churches, local churches. So we're just really blessed.
It's incredible to listen to both of you and the energy that you bring to this program. And, you spoke of the staff fatigue a few moments ago, and very much I can tell that the two of you, as I'm sure you're representative of the rest of those at True Ridge, you're doing tremendous work to say this is important. There are people who matter out there, who need these services and need this help, and that energy shines through. So on behalf of the Board of Directors of Pisgah Health Foundation, I'd like to thank both of you, along with the rest of the staff and the others who are working there at True Ridge, for the work that you're doing in serving the Latinx community here in Western North Carolina. We are very grateful for you, and grateful for you to be part of today's program. It's been a delight getting to know you and hearing and learning more about True Ridge.
Thank you so much.
Well,
We appreciate you all. Come visit.
Tell your board
when you're able.
Temperature, we'll give you a mask. Come visit. We're modest digs, but the heart rings through the door.
Fantastic. Would love to come over there and visit you guys, and thank you again for being part of the program today. And we'd also like to thank Wildflower Media for their technical and creative support in bringing these programs out to our viewers. And we also want to say a special thank you to the Board of Directors and staff at Pisgah Health Foundation, along with the Physicians Roundtable. Until we see you on the next Pisgah Health Today, stay well and be well.
Happy holidays.